All right, welcome everyone. Happy Tuesday. My name is Dr. Stacy Holweger. I am so excited that you decided to join us this evening. We have a fantastic treat for you. You are going to be so excited. So get your notepads, get your pens and pencils because you're going to take a lot of notes, I am sure. But don't worry, it's recorded. So if we're talking too fast or you don't catch it all, I will have it up on my YouTube channel tonight. So before we get started, I want to share with you that I am not a medical doctor. I have a PhD in integrative medicine and a PhD in functional medicine. Now, I am interviewing Dr. Tristan, and she is a medical doctor, but I will share her bio in a minute. She is not your medical doctor, okay? So she will not be giving any medical advice. If you have any questions about your health, your medicines, your condition, anything at all, please check with your doctor, your healthcare practitioner. Remember, the information that we're sharing here tonight about LifeWave is for informational purposes only. It's not intended to treat or cure or diagnose anything that's going on with you, okay? So keep that in mind. We are here to share information. You are in charge of your health. You make those executive decisions with what's best for you. So let me give you a little background on Dr. Tristan. I'm so excited to interview her tonight. So she currently practices medicine at Tyler Physicians in Wichita, Kansas. You know, I'll actually be in Kansas City, Kansas, next month. So not too far away, right?
Oh,
yeah. So she specializes in internal medicine and pediatrics. She's received a bachelor's degree in chemistry and biology from Friends University, Wichita, Kansas in 1998. Following that, she earned a Doctor of Medicine from St. George's University School of Medicine, West Indies in 2002. And upon completing a combined residency program in internal medicine and pediatrics at the University of Texas Medical Branch, Galveston, Texas in 2006, she began her practice in Seattle, Washington. When her husband completed his Army career in Washington, they moved home to Kansas to establish a practice and grow her roots. She currently lives on the prairie land her family homesteaded during the Ulysses S. Grant presidency in Kansas in 1870. Dr. Pierce's private practice has been providing primary care since 2009 and actively growing and thriving. She's board certified in internal medicine and pediatrics and carries the philosophy that compassion, along with genuine empathy, reaches into the soul and ultimately heals the physical body from the inside out. She champions natural health and reversing the root cause of disease. Dr. Pierce is thankful to have found LifeWave products as an additional tool in her arsenal of completing the mission written on her heart before eternity by her great and good God. And Dr. Pierce is also an executive director with LifeWave. So I am so grateful you are here tonight. Thank you so much for taking the time out of your busy schedule to be on. So, Dr. Tristan, if you could start us off by sharing with us, how did you find out about LifeWave? What made you say, yes, I'm interested in hearing or learning more about this? What did you have any needs yourself personally? Tell us, give us your background, give us all of the good stuff. We want all the history.
Well, absolutely. So I'm not a newbie to talking about LifeWave. My business partner and I, Roseanne Brozak, have been talking about LifeWave here in Wichita about at least monthly for about a year and a half now. So those that come to our meetings would know that probably I could talk your pants off all night. So I'll try to abbreviate what I say and best that I can.
We want to hear it all.
Because I think it's, we live in a day and age where the truth is not given to people in terms of healthcare. And I want to we have a local influence here, but this is an aspect to which we can reach so many more. So a little bit about myself. That was my great bio there. But so I'm a traditional doctor. I'm an MD. I was called to be a doctor from the age of 5. And I knew that from the beginning of time. And God put me on a path to become that. He actually trained me up in the MD world, although I have to say to all my chiropractor friends, I probably think a whole lot more like them. But God just needed somebody in the MD corner to be trained up this way. So I was trained up as a traditional doctor, practiced under that philosophy for a lot of years, still do. There's still lots of wonderful things that traditional medicine does to us. But in about 2018, I had a couple of miscarriages. At that point, I had lost 2 out of 3 babies, and I went to doctors that I trust, that I loved, hematologist, a great obstetrician. I said, can you help me figure out why did I lose 2 of 3 miscarriages? You know what they told me? Even though I was older at the time, oh, it's just your age. It's nothing more than that. And I knew in my heart it was something more. And so I said, you know what? I can't get anyone to help me. I'm an internist. I'll figure this out myself. So I started looking at the natural world. I started looking at what naturopaths study, at what functional medicine looks at, things that I'd never really evaluated in terms of causes for miscarriage. And what I found out after 4 pages of testing, of lab testing on myself, is I had something called MTHFR deficiency.
Mm.
Well, so I'm a compound heterozygous for that. And I'd been taking the wrong prenatal vitamin. I'd been taking synthetic B vitamins. And it was literally like a gut punch to my heart where God said, that's it. I praise him every day for that. Grief, works his purpose in your life. And it was a great grief in my life, set me on a journey of which not only changed my life, but probably changed the course of every patient that I touch afterwards. Because I learned in that instance about MTHFR, and I said, you know what? If my medical books hadn't taught me about this, what else did they not teach me about? So I started studying what naturopaths view. I looked at nutrients. I looked at, looking at health from the root cause. I started befriending chiropractors. I befriended a great friend here in Wichita, Kansas at Reardon Clinic. Looking at therapies, the frequency therapies, IV vitamin C, and started just incorporating them into what I do, even with traditional medicine and pharmaceuticals, and started seeing great outcomes,
Mm.
exponentially better than either one on their own. And so the years of COVID came around, and my eyes were open to some of the alternative treatments for that, and practice great success using some of what the frontline doctors do, which all primed me for the very moment that I learned about LifeWave. So in February of 2022, I actually have to thank dearly a patient who's now a very good friend of mine. Her name is Roseanne Brozak, for presenting me the information on LifeWave. And if you would know Roseanne, she'd tell you exactly everything that she felt bad with every day, from chronic fatigue and pain to unstable angina to high blood sugars and being disabled from fibromyalgia for many years. Sat in my office in February of 2022 on a list of medications this long, having seen every specialist under the sun, and didn't feel good any day of her life. And I knew I had nothing else to offer her. I had given her everything I possibly could, including nutrient, supplement, medication. And I simply told her, Roseanne, you know what? I'm going to pray for you. God can heal you. And that's where I left it. She came back to see me 3 months later. She was sitting in my exam room, and having done this long enough, you can look at people and know when they're well, especially patients that you take care of. And I stepped 1 foot into the room, and I looked at Roseanne. I said, my gosh, you look good. I said, what is it you're doing? She said, Dr. Pierce, you're never going to believe this. She said, I left your office 3 months ago with really kind of desperation. She said, I felt so bad. I actually prayed to God to take my life. And she said, you got to believe in divine intervention, which I clearly do. She said, a friend from South Dakota called her either that very day or shortly after and said, Roseanne, I have to tell you about alternative therapy, which are phototherapy patches from LifeWave. They can't hurt you. You've got nothing to lose. You've got to try them. So she said, I did nothing more than wear these patches for 3 months. She said, can I tell you about them? Now, most people are very kind of timid to talk to their medical doctor about something like this. Why? Because I hate to say it, but most of them are probably brainwashed to a certain degree. They can't think outside of the box, and there's a somewhat disregard for theories along that. But you know what? God had primed me for that, given the story that I told you. And I knew in my spirit, the moment Roseanne told me about it, I knew it was truth. I said, yeah, please tell me about it. I want to know more. So she proceeded to explain to me the simple, and I call David's concept of using these phototherapy patches simple, but so profound at the same time. Literally mimicking nature, mimicking what God would use already in our systems to heal ourselves. And she said, I want you to do some research on them and consider trying them. So I went home. My spirit knew it was truth, but I went home and done what I'd done for the past 6 years already, looking at alternative health, and started looking at the mechanisms and technologies and the way the LifeWave works. And I thought, my gosh, this is absolutely incredible. How in the journey of me being a doctor for this long, or studying alternative health for this long, have I not heard about it up to now? And so in July of 2022, I signed up. I signed up the biggest package because I said, you know what, I'm going to throw whatever, $1,700 at this, because if on the off chance this is right, I'm willing to lose $1,600 or $1,700, even if this helps somebody. So I bought the big package. I bought all the different patches that were available. I waited for them in my mailbox, and as soon as I received them, I called all the wonderful guinea pigs in my life that love me very much and trust me at the same time, of which I would say my mother is the prime one. And said, listen, I've got something new. I really would like you to try it. Can I give you some patches and let you get started? And it was basically the floodgates open from there. I used it on family and friends for a few months, and I finally started seeing such profound results. I remember after about 2 to 3 months of that, wondering, okay, now how am I going to incorporate this with patients? Because I'm an ethical person. I'm a medical doctor. I don't want to sell people anything. I don't sell products. I'm not, so I remember praying about it and thinking about, I've got something so incredible that I have to be able to tell people about. So I was just praying to God, how can I do this? Right. And how can I make this product available? Something you have to sign up and buy. And the Lord just was put on my heart. I mean, you know how poignant the Lord is, and he talks to you in very direct yet subtle, quiet ways. And he simply said to me, Tristan, you're not selling them anything. If you don't tell them about it, who's going to tell them about it? And I remember thinking, had Roseanne not told me about it, I would never have known. So
Mhm.
it's my duty to inform people of this. So shortly after I got a hold of Sally Fung from California, ordered a sign for my lobby, put it up in my lobby. And of course, I'm kind of a black sheep in medicine because I'm known for my alternative practices. And so I attract a lot of those patients. Just put it up there and really just let people ask me about it, honestly. And put a few pamphlets out. And the people that had the ear to hear were willing to hear, I started sharing it with. And it's been about 1.5 years I've used it with patients now. And I could give you story after story after story, but see nothing but great results with it. I'm so thankful. I'm a little disappointed it took me so long to figure it out, being that LifeWave's been around over 20 years, but I'm grateful that everything comes in its right time, right?
Mhm.
And so I'm thankful for all the lives that it will save, not only for my family, but every patient that's willing to listen in the future of this. So,
Wow. Thank you for that
yeah,
background information. I've never personally heard your story, so I
yeah,
appreciate you sharing
absolutely.
that. So I know our listeners would love to know, what patches did you start using and what did you notice for yourself personally before we get into some of the other logistics?
So first of all, I have to say that I credit God and good genes, the fact that I've had incredible energy throughout my life, where I couldn't have done what I do. And I actually feel great most days. I don't have a lot of complaints, but God knows this about me. I've worried significantly about family history of stuff. I have a significant family history of dementia in my family line, and God knows I've prayed about that for years. So
Mhm.
for me, when I first started using the patches, I was really using them, and still to this day use them mainly for prevention.
Mhm.
Because I understand in depth so well and how they work, I will never go without LifeWave regardless of how I feel, because I know the incredibly good things it's doing in my body.
Mhm.
The things that I would say I have noticed, as I'm not young by any means. I'm 46. And so I feel like I go 100 miles an hour still, even as I've aged, a couple years older, and I don't miss a beat. I have one 6-year-old daughter, so she keeps me crazy busy. And I have a practice of 5,000 patients and run a business, and I don't miss a beat. With LifeWave, I sleep well. I feel rested when I wake up. I feel my mind is very clear. My memory's good. I have great connections, and I've actually had a couple of patients say to me, who hadn't seen me in a while, Dr. Pierce, you just look like you never age. And I said, well, look at the LifeWave patches. Give it a go. But mainly for people that so my mother, for instance, she was probably the first person that I saw really significant benefits from. She's in her mid 70s, and she's had significant arthritis in her life. Now she's got great genes. She's in good overall health too. But to the point that, 20 years ago, she was told she needed a knee replacement. But she's a stubborn farm woman and just doesn't want the side effects of surgery or any sort of bad outcome that she doesn't need. And so she just puts up with the pain. To the best of my ability, I've helped her with what I can, which Celebrex has been our best thing, and she does swear by the Tommy Copper gloves. But shortly after I got the patches, I called her. I said, Mom, I've got something great. I said, I want you to try the X39 patch, and I gave her the Eon patch. And she put them over her knee. And she literally, I forgot about it at that point. She literally called me in 6 days and she said, Tristan, you are not going to believe this. She said, I have no pain. And she said, I can literally bend my knee the full amount. She said, I haven't had this range of motion in 20 years.
Wow.
Immediately, I knew, and this was within a week of getting the patches. Okay, we're on to something here. I started seeing benefits in my husband in terms of energy, in terms of particular blood test I was monitoring on him. I started with people, a couple of friends that I had who have some conditions that, and I'm trying to stay away from diagnoses here, so I'm gonna do my best, even though this is the world that I work in, that struggle with chronic pain and chronic energy loss every day with high inflammatory markers that you can actually measure their blood. I had one particular lady who literally, she was a massage therapist, had literally had to cut her practice capabilities in half because she just physically could not do it anymore. And she was worn out, couldn't spend time with her grandkids. I'd given her everything pharmaceutical wise, nutrient wise that I knew could probably help her. And we'd been working on this about a year. And literally, I can say with her symptom profile had made about a 10% improvement in her symptoms. Came to me, and this was shortly after I discovered the patches. I said, I've got something I want to tell you about. It's up to you if you want to give it a try or not. And she agreed to try it. And literally, so you can measure something in someone's blood called a C-reactive protein that measures it's a measure of how much inflammation they have in your blood. And so prior to putting her on the patches, she'd had these symptoms that were documented, and I had a CRP level on her of about 30. Which is pretty high. You really want it to be below 5. A lot of people with really low inflammation will run below 1 or 2. So we had a lot of room to move with her. So I put her on the patches, I put her on the 39, and I put her on Eon. And I had her come back at 3 months. And very typically, like I saw with Roseanne, I walked into the room and I said, oh my gosh. She said, I am so excited, Dr. Pierce. She said, my practice is back up to full size. I am massage therapy at full time. She said, I'm running leaps and bounds around my grandkids. And she said, I am so excited. Let's do my blood work. So the most exciting thing, not only was she just beaming with joy and glowing from the inside out, but when I got her lab results back, I was shocked because I knew I had literally done nothing else pharmaceutical. I'd done nothing more than use the patches, and her CRP was 8. Now, it had not completely normalized, but it had literally gone to less than a third. And this was within 3 to 4 months of me finding out about LifeWave. And I thought, my gosh, I've literally seen nothing that could do anything like this. And that, I think more than anything, I sit back with LifeWave, and sometimes I want to pinch myself and say, is this too good to be true? Right. But I'm 2 years in, and I don't think so, because the goodness is still going on. Right. But to think that I have something so incredible that can take patients' health to a different level than I was ever able to achieve before, with safety, with affordability, without the risk of causing side effects and, significant outcomes where they yank a drug 10 years down the road from the market that they finally discover is bad for you. And literally not only try to get the goals we're achieving, but many other things that happen with people along the way that just astounds me, that they didn't even realize was going on with themselves. After months of using it with people, what they'll notice things that were wrong that they just had gradually kind of declined over time that they just didn't realize. So it's almost like this, extra benefit that you get, because patients will always come to me and say, oh, well, what am I going to get if I use this? Or what can I expect? And I always sit back and I finally say, honestly, guys, I really don't know. Because the beauty is, I know it's going to do good things for you, but your body's going to dictate what needs to be done. Your body's going to take control. It's going to take priority. It's going to fix the essentials. And then you're going to get a little other perks along the way. But I promise you, what you're going to feel better. And, and even for me, I know a lot of people use LifeWave because they have a focused symptom they want to get rid of, right? Knee pain.
Yeah.
They want their memory to be a little bit better. They want more energy. But I always look at LifeWave as such a bigger picture than that. Because the way I'm wired to think about disease and outcomes and longevity is that I look at LifeWave as the ability to give longevity back, to maybe stop the things that you were going to get 30 years from now, or push them off till till it was longer, or give you better quality of life along the way so that you can live and do and accomplish whatever you were sent here to do. And so I see it so much bigger than one symptom here and there. And that if you really stuck it out long term, really, I tell people all the time, the sky's the limit on what it could do.
If you stick it out long term.
Yes. Yes. Very good.
People come into us very tunnel vision, right?
Yeah.
They have these issues.
Yes.
These are the things on their grocery list of problems, and they need them fixed immediately. You're like, well,
you didn't get there immediately, for one. Second of all, it's probably going to take some time to recover. But then, and this is the case with patients in general, right? I mean, they want the symptom recovery. They don't want the benefit of better wellness. And people, LifeWave obviously doesn't replace good choices in life. I mean, really, health and wellness is a big bag of, a good sleep and good psychological health and good spiritual health and nutrition and taking care of your lab work and all of that and exercise. But if you could pair all of those good choices with LifeWave, literally you could have a life of fullness and wellness to a degree that you probably would never, ever understand or recognize otherwise. And people always ask me, okay, well, what if I use the patches for a few months? What happens if I stop using them? Well, what would happen, right? You're going to regenerate some tissue that you've lost. You're going to detoxify a little bit. You're going to lower your inflammation. You're going to get yourself at a better plane than you were before. You're not going to lose that. The problem is if you stop that, you're going to go back and age at the same rate. You're going to go back and degenerate at the same rate at which you are. And so, the goal is to achieve that plateau, but then maintain it as best you can. So, people can put their priorities and their money where they want to, but as long as I possibly can, will never be without LifeWave, because I want to live as long on this earth as I possibly can to do what God called me to do here. And this is probably one of the best ways that I've ever encountered and in the ability to tackle wellness that I've ever seen before. Because when God designed something, it goes back to simple physiology. When God designed something, he designed it very good. In fact, he put Adam and Eve on this earth to live eternally, right? Now we messed that up. And I hate to apologize for my faith in God, because that's so ingrained in who I am and so a part of how God gave LifeWave to the world, right? Through David, thank God for that. But we never want to work against what he did. And in fact, some things that we do kind of counteract the mechanisms in place. Not that medicines are bad, but medicines have their place, but medicines can be harmful to some of those mechanisms. I always tell people, I meet you where you're at. If you're going to be somebody who's going to smoke and drink and not take care of yourself and not do these things, then you're probably going to have to be medicated to make it, right?
Yeah.
But if you're going to be somebody who's going to try to get to the bottom of why you are the way you are and reverse some of these things, you know what? Maybe we can get you off medication. Maybe we can get you on a different path where we can reverse some things. And LifeWave is probably the prime thing to help someone do that. Yeah. Absolutely.
Oh, I totally agree with that. And I love that you mentioned those core practices.
Yes.
The nutrition, the sleep, the water, the prayer, the breath work, meditation, outdoors, exercise. We have to have all of these things. But, like you said, I always call this a tool in my toolbox.
Yep.
I have a lot of tools in my toolbox, but I agree with you. I haven't found anything in my 20 years of holistic practices that I've ever done what this does. And I think, like I said, people come in with this tunnel vision, but if they can step back and see the bigger picture of increasing their health span,
Yeah.
right? How long are you healthy? What is your quality of life? Yeah, you're probably in a pickle right now. Let's get you out of the pickle, right?
Yeah.
Like you said, your patients are coming back in a few
Right.
months later, and you're like, whoa, what's going on with you? You look totally different. And we know, of course, collagen production starts coming
Yeah.
back online around 3 months too. So we're like, whoo, our skin's looking better. But something's happening on the inside. And the longer you patch, for those of us that have been patching like yourself a couple years, and some of us on here 3-4 years now, we've been patching or more. Some people, have been patching with us for, the whole time, right? We have David Jumper that's been patching for 20 years.
Wow.
You're like,
God bless
wow,
that guy. Yeah.
yeah. And so, but what that means is, you're really taking care of all of the important things, your organ function.
Yes.
That mitochondria is critical, that mitochondrial function.
Absolutely. If you don't have mitochondria working, I mean, they're the powerhouse of your cell. There's not enough energy to repair anything. In fact,
Mm.
there's a theory that, some cancers develop because there's not enough energy to repair the cellular DNA
Absolutely.
damage. Right. And so that's vital. I mean, you go to these basics. And the other thing I would say I love so much about LifeWave, because it kind of laxes how hard I have to think. When I'm an internist and I practice medicine, I really have to come up with a diagnosis on someone, right? And sometimes diagnosing people is difficult. You have to have a litany of MRIs, CTs, PET scans, lab work.
Mhm.
Autoimmune diseases are very difficult because there's no standardized test for them. So diagnosing people can be very difficult, especially because people don't always follow a textbook, right? But to give them a treatment plan, I have to have a diagnosis. With LifeWave, you don't need a diagnosis. It
Mhm.
doesn't really matter what you have. It doesn't matter how old you are, what you have, what you don't have. You put the patches on someone, and you're essentially just rewiring their system to work itself out. And so you can almost trust that there's a lot of leeway to be wrong, or to, you can't have the wrong patch. You can't pick a wrong patch. Okay, people say, well, what patches should I use? Well, anything that you pick is going to help them, right? I mean, you can prioritize some based on symptoms and whatnot, but any patch that you choose is going to help them.
That is very true. Any
Yeah.
patch that you pick is going to benefit your health in some way because they all impact your health in a positive way. I love
Yeah.
that. What
Yeah.
do you say to people when they're like, where do I put the patch on? Where do I
Okay.
put?
Yeah. So what I say is, okay, so if you're one of those science buffs who needs the, like we have in the pharmaceutical world, you got to read the studies and you got to see that it's FDA approved and statistically significant. You have to see the studies. Then you're the type of person that would do exactly what David said, right? With his statistical significance with X39 behind the neck and below the belly button.
Mhm.
Truthfully, when I practice medicine, I don't need that. I just need to see results. And if you understand how the patch works, right? Its crystalline lattice is activated when exposed to your infrared light. Well, you're emitting infrared light all over your body. Essentially, wherever you put it on your body is going to be activated. So what I tell people is actually, if there's a problem area on your body, I'd put it directly over the area that you're having problem. I've had some significant improvement with patients with serious, my husband tore his MCL, PCL, and 2 ligaments in his ankle in the same leg a year and a half ago. Horrible. Could not walk. Went to his orthopedic doctor, and I thought for sure he would end up in surgery that day. Ortho says, nah, let's give it 60 days. So you're probably still going to need surgery. And I thought, are you kidding me? Well, I took the Eon and 39 patch directly on the knee, directly on the ankle. Do you know in 2 weeks his ankle was fine? Walking, no swelling, no pain. In 60 days, that knee was still a little painful, but swelling gone, full mobility, went back to ortho. The maneuvers were there and joints were stable, no surgery. So I always say, I think I got a little bit more out of them when I put them directly over his problem areas. And people can say they actually sometimes feel kind of an immediate response if you
Mhm.
put them over those direct areas too. Now, if you don't have an area that's giving you a problem, give an area that you put it over an area you're worried about. Are you worried about your heart? Put it over your heart. Are you
Mhm.
worried about your brain? Put it close to here. But honestly, it just really doesn't matter. It's extremely forgiving. It'll be activated anywhere.
Yeah, I know. I always hear people that put it on the back of their neck, and yet their eyesight improves and their digestive issues are gone, and they have all these other things that happen that have nothing to do with the back of their neck. And I'm like,
Correct.
well, that's called a systemic reaction.
Correct. It's because of GHK copper. It's doing exactly what David said it would do, which if you just read about GHK copper peptide, it's astounding. The effects of that one peptide in the body, of course, you're going to get a reaction all over the body. Yeah.
Yeah. Okay, so tell us, you've kind of alluded a little bit here with it, but tell our viewers, because obviously we have, almost 700 people that are on here right now. How does this patch work? You said, it works with our body's infrared light. So give us the lowdown here on how it works.
Yes. Okay, so what the simplicity of what I love is how David came up with the idea. So this is something that your body's very familiar with on a day-to-day basis. When you go stand in the sunlight, you feel better. Why is that? Is because the light frequency of the sun will hit your skin and activate your body to make vitamin D and melanin, which tans your skin. These are very natural processes. So, yep, there you go.
I
You
love
got
being in the sun.
yes. It's called photobiomodulation, right? So what a natural way. So David converted his work into a wearable form of light therapy that is in the form of a patch. And I always explain it then in simple terms. It looks like a circular Band-Aid. That's what it looks like to me. And it's very simple. And there's nothing more than an hypoallergenic adhesive on the outside. So it sticks very well to the body. And where that white center area is organic crystals. And they're doing nothing, which means they're completely inert when the paper stickies are on it. It's only when it's put up next to your body where you emit infrared light that it activates the organic crystals in that area there. And crystals in physics, if you're familiar with what they do, they emit a very specific frequency of light. So he was able to find the very specific frequencies of light that do other very specific positive things to the body outside of what the frequency of the sun does. And so in one patch will be one light frequency. And in the most famous patch, X39, is the light frequency that elevates your body to make more GHK copper peptide. And that peptide in particular is kind of known as the youth serum. It was discovered in the 1970s. And when I was first looking at the patches, I just started looking at all the effects of GHK copper peptide, and I was shocked. I was literally shocked at all the positive effects. And when I think that of the effects of GHK copper peptide, I don't think it's talked about much, but is most profound to me, honestly, more than the regenerative capacity it's the gene whisperer, right? So we have this DNA code that we're born with, and we're all born with some imperfect genes. We're born with some good ones and some bad ones, right? But, when we're 5, if we're born with the Alzheimer's gene or the BRCA1 mutation, right, our body's not expressing it. We don't get breast cancer at age 5. We get it at 65, right? Why is that? Is because the body's astounding capacity to cap those genes, to methylate them, to essentially turn them off and not express them at that age. And that has very much to do with the amount of GHK copper peptide that you have in your blood. So gene expression is huge. And when I think about, like I was talking about longevity with disease, that simply alone, the ability to not express your bad genes the longer and until the older that you are could mitigate many, many different health conditions of your life. I look at that as probably one of the most profound things to prevent disease that probably exists, honestly, because of that ability alone, gene expression.
I think we need to take a snapshot of what you just said right there. If everyone got that, that was so profound.
Yeah.
And
Yeah,
we talk about upregulating our genes, right? That's a beautiful benefit of GHK, but I don't think people really realize the implication of that.
No, because most people probably don't understand genes and physiology the way we do. But when I sit back and I look at that, I think, my gosh, I don't know anything else that has this capacity. And really, honestly, to the degree that, and I tell my patients this, and when we talk at our LifeWave meetings all the time, we were meant to live eternally. Now we messed that up, but we were still given, even the Bible, God still gives us 120 years.
Mm-hmm.
And to this day, I've never yet taken care of a patient that was 120 years old. I
Wow.
think my oldest patient that I've taken care of probably made it to 104, 105. So what does that tell me? That tells me as a Christian, there's years being stolen from our life.
Mm-hmm.
And that has God given us a way to maybe reclaim some of that by preventing some of these chronic diseases that we could get that could take our life sooner? Absolutely. And
Mm.
it could be in the form of something that can suppress those bad genes longer and out. And so I look at that and say, man, this is monumental, honestly.
Wow. Yeah, I totally agree with you 100% on that. It is. I'm in the same situation with you as prevention, vitality, longevity, overall wellness. I've always said I'm going to be here 150, 200
Go for it.
years. I've always said that my whole life, had no
Well,
idea
speak it.
how. Right.
Yeah.
But if you can see now
Yes. Now you can
that
see.
you having these healthy
Possible.
practices, healthy lifestyle choices, like you said, we're not going to smoke and drink and then expect to live forever, right? But having these healthy practices and utilizing this tool that literally helps us reclaim our youth
Yes.
and protects those telomeres, right? Help
Yes.
the body to stay in that young, youthful, healthy state. Woo.
Ooh. Yeah.
Yeah, that's
Yeah.
I was going for a walk today with my son, and we were talking about something to do with longevity, and we were talking peptides. He's really big into all peptides, right? He's 19. Peptides are all the rage in the gym, and he won't do any injections. He uses patches. But
Right.
he's researched all the peptides, and I said, "Well, I'm here for the long haul. 150, 200 years." And he goes, "That's like another 100 to 150 years you're going to live then." I said, "Yes, we are."
Yes. We got to speak for it, and you got to speak forward truth in your life and claim it, right? You
Yes.
you you put forward into motion things, and
Mhm.
so speak goodness.
Yeah, absolutely. Okay, so let's talk a little bit. We have about 20 minutes and we have some questions in the
Okay.
chat. So, for people that are concerned, first of all, with any
Okay.
contraindications or side effects with the patches or interactions, because you're obviously prescribing medicines as well too.
Absolutely. Yes. Okay, so first off, contraindications. There's literally only one, and that's with the two patches, X39 and X49. You should not use them with anyone who's had an organ transplant.
Mm-hmm.
And the reason that is that will wake up regenerative cells in that transplanted organ that you're trying to suppress. Actually, that's why you take transplant rejection medications, so you don't have a graft host rejection issue there.
Mm-hmm.
However, in transplanted patients can still use the other patches, Eon, carnosine, glutathione. In fact, that would probably help them to a certain degree. As far as side effects, I literally would champion the patches to say there's literally none outside of two things I've seen. So if you use the glutathione patch, you have to be careful when you first start using it, because a lot of us born in this modern day and age are extremely toxified from just the toxic world that we live in. And
Mm-hmm.
so sometimes you don't realize that. And so the first day and I don't drink or smoke or do any of that. I just live in this world. The first day I used glutathione, it didn't dawn on me, but I was aching all over. In fact, so much I thought, oh my gosh, I'm coming down with influenza. But I had no sore throat. I had no congestion. It wasn't until I took the patch off a few days later that I realized, oh my gosh, I was detoxing that aggressively within that first day that I felt it all over my body. Now, luckily, it did such a great job that the second time I used it, I didn't have that at all. So be aware that if you use glutathione, you can detox pretty powerfully. So if you feel that, take it off after an hour or two, set aside, know how many hours you have left on the patch, and go back to it another day.
Mm-hmm.
With that, you're going to have to drink a lot of water because you're mobilizing a lot of these chemicals and have to get them out of your system. Okay. And then the other thing I would say is sometimes, occasionally, it's not very often, but you'll get somebody with kind of some headaches with X39. Or I've had a few people just say that they didn't feel quite right. And actually, what I've done with them, and I really think what's happening with that, either they're not drinking enough water or there's this kind of rebalancing that's happening in the body. And everything's trying to kind of work itself out and redirect and find a healthier balance, and sometimes along that way, while the body's trying to figure that out, they don't feel as great. So what I do with them is I say, okay, back off, use a patch, and stop using the patches until you feel better, until you feel back to baseline, and then maybe go to one every couple of days. And then if you start feeling okay with that, then maybe go to every other day or every day. And I've pushed two or three people through that process to find where they're on to them every day and they're now receiving the great benefits. But other than that, I don't hear of anybody complaining of any other side effects.
So what do you feel? Touch a little bit more on water, because I'm always a big proponent of water
Yes.
and Celtic
Yep.
sea salt, get your minerals. How do you feel
Okay,
about that?
yeah, so what people don't realize about water is water dictates your body's hydration level, right? I mean, your body's 80% water. Your blood volume, which carries everything that you need, enzymes, vitamins, proteins, peptides, sugar to the cellular cells, is all brought to you through your bloodstream. You know what happens when someone's hypovolemic or they're extremely dehydrated, right? What happens? They shunt all their blood to the center of their body for protecting the central organs. Well, what happens to the blood supply to the extremities and it clamps down. Therefore, you're not getting the needed chemicals and nutrients and oxygen to those tissues. And so how can those cells work at optimum capacity if you're not doing that? So on a chronic basis, if you're chronically dehydrated, you're chronically somewhat hypoxic in your tissues. You're chronically not getting the energy. You're not getting the vitamin delivery that you need to work at optimal health. So water is key because it dictates your blood volume, and your blood volume carries everything to the cells that need it.
And we know so many people say, I just don't like water, or I drink enough water. I have 3 glasses a day.
Oh no. Yeah, I tell them shoot for 80 ounces a day minimum. You know, you really, if you have a functioning heart, you don't have liver failure or kidney failure, you really, and don't drink it all at once, you know, to get water toxic. Really, you want to be above and beyond. That's the way you eliminate waste. It's the way you mobilize everything. And people just feel better. It's amazing. I'll get people in the office with the horrible gastroenteritis. If you've ever had the horrible vomiting diarrhea, right? Well, I can't give them anything to stop the virus, but what do I give them? I give them IV fluids. And it's crazy. After 1 hour of IV fluids, nothing's changed with the vomiting diarrhea, but they say, my goodness. And you could see it all over their face. Their hydration status has changed. They feel significantly better.
Yeah.
So it's key. It's
It is.
prime.
Yeah, definitely. Okay, let's talk a little bit about some different organs, okay? Different parts of the body, because we're getting, there's lots of questions, and we're going to try to address as many as possible with just saying, let's talk about the brain.
Okay.
Anything to do with the brain from your patients, from your experience? What have you experienced or noticed?
Okay, so you know that one interesting thing I've noticed with the patches, and I did this talk on a Zoom last week where David has the model where you've got the topography of the brain, right? And how it's communicating better the hemispheres within a few weeks of using the patches, is it goes completely analogous to what I see in real life, is that people will want to use the patches for their knee or their fatigue or whatever, and almost inevitably the things I hear most from people within the few weeks is almost always they're sleeping better at night. And almost always there's something happening that they're just thinking more clearly. So what does that tell me? This is generally X39, right? Because most people start with just 39. And so what does that tell me? That tells me that really the body's prioritizing the brain, right? And some of the first symptom relief that you get is coming from the brain itself. And what's probably happening in that scenario is, you're getting so neurologic tissue is one of those kind of tissues in the body. You can't count on healing itself very well, right? You have someone with a spinal cord injury, you have someone post-stroke, right? There's no guarantees on if that tissue is going to get better or not. So when you've got damage to neurologic tissue, and I would say we are all victims of that every single day, from radiation, EMF radiation, to heavy metals, to aluminum, to the fluoride in our toothpaste. I mean, these are very neurotoxic things that we know of. So to some degree, we're all experiencing a lot of neurodegeneration, more than probably generations have in the past. Is that the simplicity of the ability to already start regenerating some of that loss? You're going to notice it. Your body prioritizes the brain, and you notice it quickly with X39. The other things with the brain that I look at when I look at the patches, so I've got people that want to focus on neurologic issues, is the ability to detox well, right? So talking to them about utilizing maybe glutathione. And then the other thing with the brain itself is there's a lot of conditions out there that cause a lot of what we call neuroinflammation, right? So neuroinflammation, these are people with the high CRPs, but they may have autoimmune conditions, they may have toxic chemicals, they may have other things that they've injected in their body that are neuroinflammatory. And so decreasing the inflammation on the brain. So if you could tackle the neurologic system by regenerating cells, by detoxifying, by lowering inflammation, those three things alone, and improving mitochondrial health, wow, the brain has a chance at that point, greater than it probably ever did before.
Yeah.
Okay. So,
You're
and there's
talking X39 Eon, energy
glutathione,
enhancer,
maybe
glutathione.
cancer, absolutely. If it's an inflammatory condition, when you lots of cardiovascular things cause one of the primary causes of a cardiovascular event is inflammation, right? Which causes stroke, right? So one of the ways you can tackle cardiovascular issues is to lower the inflammatory level, right? You can have people with super high cholesterol levels that have a low inflammation and never have a heart attack or stroke in their life simply because they have low inflammation. So there's a lot of different ways you can tackle that. The other thing I would say with the brain is, our emotions come from our brain, right? Our brain and our heart. And there's a lot of people with psychological issues that end up, true deep psychological things can really impact physical health, right? And so the two go hand in hand, and you can't disconnect them to some way. So if you can help the brain, you can help psychology to a certain degree. That can help an outlook, that can help motivation, that can help people make different choices down the line. You put those all together and you've got a whole different working system in a positive way.
Oh yeah. We don't think we talk about that enough with the emotional, psychological, mental types of issues that people deal with that we know are causing a lot of these
Absolutely.
physical things inside of the body that are happening.
Absolutely. Yes. Yeah. So I think when you hit the neurologic, you hit a lot of different things.
Yeah, you do.
Yeah.
Yeah, and I agree with you. That study that David did, where you can see the brain mapping and look at the coherence of the brain, really starting to come into alignment around 6 weeks. Sometimes people are like, well, I patched for 30 days and I didn't notice anything. I'm like, whew, let's give it,
Give
3
it some time.
months. Let's give it, 6 months, 12 months. Especially when you look at someone with a chronic issue, that's been going on for 10, 15, 20, 30 plus years.
Yeah, absolutely. Well, and I always bring it down to the simple when I talk to patients or the groups that I have here is like, look, you have cells that go together in a mother's womb that are nothing but cells, right? Not even differentiated cell lines yet, but they don't make a 7, 8, 9 pound baby for 9 months. Do you know how long it took that body to generate that tissue and grow those organs? Well, your body's 10 times that size. How long do you think it's going to take you to regenerate? I mean, sometimes just putting it in simple terms, and I also think things, God allows us to go through things for a reason, right? He allows periods of suffering so that we learn things along the way, so that it profoundly impacts us so that we never walk that path again, right? And so you have to just be patient, wait for what God's going to do and the time that he's going to do it, because it's going to accomplish its goal if you're patient enough to trust him. Yeah.
Yeah, and that's the key, to be patient enough to trust that process, to trust in the divine process that's taking place in your body. You were led here for a reason.
Yes.
Right? I felt like when I found out about these patches, the first time I was like, wow, this is incredible. And then the next day I get the call from April and I'm like, whoa, something's going on here. God's moving, and then after I got off the phone with April and I talked to a couple other ladies, and then I found out David was coming here to my area a few days later. I'm like, okay, the earth just stopped. The seas have parted, and enter LifeWave, because this is so profoundly divine. And Laura and I went to that first meeting with David, and I mean, we just sat there with tears and
Yeah.
cold chills, just chill bumps everywhere. We're like, oh my God, we have to tell the world.
Yes, exactly. And you know what I love about David so much? I've never met him I got to see him in October. I went to the meeting in October. I got to see him on
Mhm.
stage, but I've listened to him so much. I've learned most about the passages listening to his webinars.
Oh,
Is
yeah.
he's got this incredible mind, but you know, if you've ever known that really kind of science geek, sometimes they can't get down on your level and talk to you. He can talk to people. He has
Mhm.
a real heart for people. His warmth, his love for God, his love for people comes across, and he's such a humble person
Mhm.
when most of the world would never be. And so it's clear like he is walking the mission God called him to, and praise God, he's strong. I mean, I think about everything he's had to stand up again. And, you know, in the world that I practice, like this stuff is really looked at as kind of voodoo, kind of quackery. You know, I
Mhm.
hate to say that. I'm ashamed to say that as an MD. Shame on my colleagues, right?
Mhm.
But to stand up against a world like that and be brave and still do what he's going to do and take the flack against whatever the FDA may throw at you. I mean, kudos to him.
Yeah.
Like, what a superstar.
Yeah.
Yeah.
Well, and I've had the fortune of being able to actually personally get to know him really well over the last 3 years, and he is all of that
Yeah.
and so much more. When you can sit down and have breakfast with him or have lunch or dinner with him, and he just, have a regular, normal conversation like
Exactly.
anybody, or drive race cars with him. I got to do that a few years ago. And, he loves a good Audi R8 or Ferrari. I
Yeah.
mean, he's just a normal person, but
Yeah.
he is a normal person that chooses to stay connected to God and
Amen.
listen to the words that are being put, just like you did, right? When God said to you, look into this.
Yeah.
This is something to look into. He was listening as well too, and always has. So we are in a very interesting time where
Right.
allopathic medicine has a place and it's done its job in certain situations, but we're also in a place where it's really not been beneficial for a lot of people. And I think the veil is lifting and they're understanding like,
Yeah.
whoa, there has to be something else out there, just like just like you're a patient, right? God, bring me something or take me. And I can't tell you how many people's testimonials I've heard where they've said that. Take me, like bring me something or take me, and here comes LifeWave.
Well, and you know, God can always take bad and turn it for good. I look at the years of what COVID did to our system and our people and the long-term side effects they've had and the breaking of the system. And I think, but God in some ways is using that for good
Mhm.
because people are waking up to the fact that we're not being told the truth or we're being hidden the truth, that
Mhm.
there are other forms of healing that the rest of the world has known about for years, and that, you know, maybe there's hope in something else. Where here in America, none of us were really wired that way from the time we were growing up.
Mhm.
And that's extremely unfortunate. And the media, thank God for social media and things like this.
Right.
You know, what the world's been able to find out because this, and I hate technology. This is a weakness for me. But you get out there and do it because there's a world of hurting people. I mean, once you discover LifeWave, you feel this tug on your heart, like I've got to tell as many people as I possibly can
Mhm.
because I don't know how much time we have left. I don't know how much time the next person beside of me has left.
Mhm.
But you know, we all have a chance to share with everyone in our life. We just have to be brave to do it. I tell people this every day, be brave. You know, what have you got to lose? Tell them about it. Ask them. And I finally say this to patients is, you know what? Go pray about it. You go ask God about it. You
Mhm.
go do the research and make the decision for you. I don't want to decide that for you. But almost inevitably, when people put the time and the effort in to look at the information and really get in touch with the creator, they always come back and say, yeah, sign
Mhm.
me up.
Yeah.
So turn it over to them.
Oh yeah, which that's where the health should be, right? You're in your own hands.
Should
Your health
be,
decisions should be. Yes.
should
And
be, but
yours.
sometimes hasn't been in the past so many years, right?
Yeah. Yeah.
Unfortunately.
So let's
Yeah.
turn it over to our heart. We have about 5 minutes. Let's talk
Okay.
about this cardiovascular system.
Okay.
There's tons of questions in there about the cardiovascular system.
Okay. So what do you need for a good working heart, right? So first and foremost, your heart's a muscle, right? So you need a good, strong working muscle. So, and that muscle pumps. You can count it up how many beats per minute you got times how many minutes a day that you don't even have to consciously control. So you need a good, strong working muscle. It needs energy supply, right? So I always look at the energy patch almost behind every true vital organ, especially one with the energy capacity. And by the way, the brain takes the most energy of the body anyway, but heart is very next to that. So energy would be key. The other thing that would be very key, and I kind of alluded to this already, is that when you're looking at cardiovascular disease, the way I look at it, you're looking at many root things happening because of inflammation. In fact, they've looked at the vessels themselves, feed the coronaries, and you can have lots and lots of cholesterol running around that vessel that's never gets stopped up, that never forms a plaque until the vessel is injured, right? And the vessel's injured by inflammation. And so simply lowering inflammation will lower your risk of probably cardiovascular disease. Even your cardiologist will admit this, and they'll admit this because of the level of the CRP actually can determine your risk of having a heart attack, right? You can actually measure that in the blood, but yet they won't go beyond and say, well, if you lower your inflammation, you lower your risk of having a heart attack. But, let's put 2 and 2 together, right? Okay. Okay, so that's key. I would also say one thing, when you look at people who've had something like a heart event or a heart attack, and I have to talk in these terms because a heart attack is simply just means you've had damage to your heart muscle because it lacked oxygen and the muscle was injured and part of the muscle's not working. Okay, that's what's happening on the basic physiological level. The problem with the heart muscle is sometimes it doesn't heal very well, right? And so you have kind of malfunction in that area. And unless that muscle tissue could be regenerated, you may not reach full cardiovascular capacity for the rest of your life. So if you had something that could stimulate regenerative cells in that area, you may be able to heal from something. In fact, I've got a couple of patients that I've seen improve what's called ejection fraction after using the patches. And I've got a couple of other patients that had dysfunctional valves that were leaking that on echo were showing better stability, graded from a moderate leakage insufficiency down to a mild. So what's happening in that scenario likely is the body's identifying a couple of areas that need to be regenerated and going and tackling that and putting new tissue there. The other thing I would say too with the heart is toxicity too. There's a lot of things that get deposited in and we look at internal and maybe even more so with the kidneys, but there's a lot of things that get deposited in our organs. Our body stores them in areas to kind of keep them out of the bloodstream. And to kind of keep them away from kind of the center areas. But if you could detox certain muscles, you could get the stuff out of them, get them working better, get them at better kind of functional capacity.
Yeah, and that's the thing I don't think people really realize is what the environmental toxins
that
we're exposed to with our cleaning care products, personal care
cosmetics,
products.
shampoo, toothpaste. Yeah, no, I went down that route in 2018, and I remember reading that. Just going through that, I threw out everything that I had, and I thought, oh my gosh, I don't even know where I'm going to shop anymore. I literally didn't want to eat anything. I didn't want to use any soap. And thinking it is God's grace every day that we are all still alive. That is how good of something he designed, because even despite all of it, most of us are still here. But we could significantly help ourselves out if we understood some of these things. You don't have to change everything in your life, right? But, if you could just cut out artificial sweeteners, or if you could just stop smoking, or if you could just, use an aluminum-free deodorant. Pick a few things and a little bit adds up. Right? But educate yourself, because unfortunately, with industry and society and companies wanting to sell products, they don't have your health. They don't have your interest at heart. They're wanting to make money. So it's on you. Your health is on you. And it's a huge responsibility. People would like to turn it over to their doctor, right? Or their parent. You can't do that. There's too much out there. There's something's going to get you if you don't understand what's going on and make the best decision for you, because, none of us are promised tomorrow. We've got to do everything that we possibly can do to get one more day out of this life to finish what we were called to do, or it might be called short. And that's unfortunate. It's just the day and age that we live.
It is. I love that. Thank you so much. That was just like the perfect to sum everything up. We've got to do everything we can. And yes,
Yes,
we've got to start small, do one little thing, just put that patch on every
you
morning
got
and
it.
use a fluoride-free toothpaste and drink clean, healthy water.
Filter your water.
Filter your water, get organic, non-GMO, antibiotic free. Just
Yeah.
but little things do
Little
add
thing.
up and they
Right.
do all matter. They really do. And so start where you are. So if you're a guest here tonight and this was your first time listening about LifeWave, we want you to get back with the person that invited you. They're going to help answer any questions that you didn't get answered through listening to Dr. Tristan tonight. And of course, share with you our resources, start x39now.com so you can learn more, read more into the studies like she was talking about, or watch some of David's videos. There's so many on there that's linked to LifeWave's YouTube channel to watch all of his videos. So there's a plethora of information out there. You just got to go day by day and do what works for you, what resonates for you on this journey. But we'd love to have you on this journey with us. And I'm so grateful for you, Dr. Tristan, for taking time this evening out of your busy schedule to be here tonight to
Yes.
educate everyone. I know there was so much value gained, and I'm just so grateful for the time to get to spend with you and
Yes.
meet you. And I look forward to seeing you. I'll be sure to lock arms with you at convention and take you right up to David so you can meet him in person.
That'd be great. I'll count you in on that. Yeah, for sure.
Awesome. Well,
Bless
thank
you
you
guys.
so much. Thank you.
Yep.
Bless you and have a fantastic evening. Thank you, everyone,
Bye-bye.
for joining us. Bye.